So my name is Johan. Today we're going to start on the demonstration of the debridement. In this case, we'll be using a chicken leg or a drumstick, all right, to demonstrate. So instruments wise, what we're gonna need, okay? Obviously, we're gonna need a blade. So this blade, I already put it on a needle holder, and then we mount it to this couple handle. Then we also need a tooth forceps and also a tissue scissors. Notice that it is curved when looked at from the side. Now extra, I'm going to use a rondure later. Alright, this is to nibble off the bone later on. Okay, let's start. First of all, this area with the foot dye is marking where the presumable injury is. So the aim of the debridement, of course, is to remove all the non-healthy tissue. Alright, in this case it is marked by this foot dye. Alright, so what is the most important is to have a sharp dissection to remove the tissue. This is what I'm going to do. Okay, so I'm grasping the tissue, okay, with the tooth forceps. Why tooth? Because it is atraumatic, it is sharp, so you don't have to use a non-tooth forceps to crush the tissue. Tooth forceps require less force to manipulate, so you don't traumatize the non-injured tissue. And then with one swipe of the blade, do a simple swipe and a clean swipe to remove the margin of the unhealthy skin. Notice that I did not excise it right smack at the border, but rather I leave 1 or 2 mm, okay, of the non-healthy skin, or of the healthy skin rather, to be excised together with the lesion. Now same goes here. Usually, of course, in real life, this will be a puncture or through and through kind of wound until the fracture site, if it is an open fracture. So now same goes here. Keep it in tension, and then one clean swipe. The smaller the wound, obviously this one is going to be harder, but we do what we can. Again, keep it in tension, one clean swipe until the end. Okay, something like that. Okay, now next, after the skin is done, all right, next we go on to the subcutaneous tissue and also the fascia, the muscle, whatever comes right beneath. Here, of course, because it's chicken, the subcutaneous tissue is not very well demonstrated. What we see here is probably straight away the fascia and the muscle underneath. All right, so again, because of this presence of food dye here, it is presumed dirty or contaminated. Let's remove this. Again, use your tooth forceps. Excise it. All right, no hard and fast rule way of doing it. All right, but of course the best way is to use sharp dissection. Okay, in reality, in OT, for let's say for a real patient, you will see people using diathermy. All right, because as it cuts, it also leaves a it also coagulates the bleeding. So let's see the edges. I'm still not happy with the edges. There's still some color food dye there, so I'm going to continue the same process until the edges are normal. Then only we stop. If we just stop when the edges are not satisfactory, then it's going to get reinfected. All the unhealthy tissues are presumed nidus for infection. They will die, and then they will become nidus for infection, and then patient have to go in back for debridement again. Alright, so see underneath here, not great lah. Alright, so this have to go. Sorry. Now you might notice that as we go deeper and deeper, it's becoming harder to excise using a blade alone. Alright, you might get worried also. You might injure other healthy structures. Sometimes it helps to extend the wound from the original site of the injury, to extend it nicely. All right, and then maybe using a pair of tissue scissors, dissect. All right, so that it's easier. Don't struggle. All right, don't struggle. Make sure you see the tissue nicely. See sini, not very nice kan? So you can open up some more. Here I don't open up because the skin will split. So you see now even clearly the unhealthy tissue inside. From outside it just look like a very simple one dot kind of thing, right? But inside it's all messed up, all confused. This is not unusual, not unheard of course. You will see this in open fracture. You thought it's gastilo 1, just a puncture wound, open inside, and then you'll notice that it is actually a lot of soft tissue injury. All right, we have actually arrived to the fracture site. This is the distal part of the tibia. All right, chicken tibia. So here I'm using the tissue scissors to carefully remove the unhealthy tissue. Compared to blade, of course, tissue scissors is more traumatic to the surrounding tissue. Why? Because scissors work by a crushing kind of thing. Okay, because two sharp blades coming together and it's supposed to amputate that unhealthy part. Although less preferable than a blade, I mean theoretically, but in practical situation it's not easy to get the blade inside there. You might end up injuring other things also. Now you'll notice that sometimes people use a curette. Curette ni benda, curette is something like a spoon kind of thing. I'll show you. Something like this, yeah, like a metal spoon but with sharp edges. All right, so sometimes in a hard to reach places like this, it's useful to have curette, so you can just scrape all this unhealthy tissue. See how easily the unhealthy tissue comes off. All right, and whatever tissue that comes off with it is obviously unhealthy, because healthy tissue, if you scrape, nothing will come off. All right, might be useful in places where there are a lot of fat. You might think, this one is yellow, not good. Usually healthy tissues are pink, right? But it's yellow, but it's actually fat. If you scrape unhealthy fat, it won't come off. All right, so we are already at near the, there's some devitalized bone which I removed. Devitalized bone not attached to surrounding tissue can remove, because it will die and it will candidiasis for infection. All right, so when there is an open fracture, how to access the tissue behind there? Not easy, right? So we can deliver the bone using an instrument. Usually we use a bone clamp or a bone holder. In this case, I'll be using this, something like that. All right, and then when I can clearly see the edges of the fracture site, I can just clean it with a curette and then irrigate it with a lot of saline, something like this. While washing, use the curette and clean it up. Now let's say one of this bone end is done, then we go on to fish for the other bone end, deliver it, and also clean the edges. Let's see if we can do that here. Not easy, but we can kind of get to it. You see, if I don't extend the wound just now, see how difficult it's going to be to deliver this end, and then struggle, pull here, push and tug, you'll end up injuring even more the surrounding tissue. So might as well just open the wound a little bit bigger and not causing excessive trauma to the healthy tissue. If excessive trauma to them, and then later it will become devitalized, later become risk for infection juga. So something like that, you clean it up. Here you can notice that it's still full of color. Not easy to clean because we don't have running water and all that. All right, irrigation. For demonstration purpose, I'll just show you the general idea. Any more devitalized bone? No, not really. That one seems like muscle. Now you might be wondering, is it okay to remove all this muscle? Muscle can lose until 60% of their bulk without losing function. That's the theory behind it. Okay, so if you feel that you have to exercise, 50% tu kira okay lagi lah. Alright, but if let's say lose until 60%, then you might have a reduction in power. Another issue to consider is of course neurovascular bundle. Let's say you know for a fact that there is a neurovascular bundle running here, nerve and arteries and all that. So that one you have to be careful, and even though it's not that clean or not that healthy looking, you might want to consider preserving it, especially if it is vital for the limb punya survivability. Later you will have a clean wound, you exercise neurovascular bundle, you have a clean wound, but a non-functional limb. So also, so there's always a balance between the two. All right. Sometimes there you also have that system of cleaning from superficial to deep, and then apa from center outwards. Okay lah, you can follow your way of doing it, but of course the aim in the end is what, to obtain a healthy wound bed, for a good wound healing, to reduce the risk of infection. All right. See all this still having abnormal color, remove until see you have nice edges here, nice chicken meat. In a real patient, especially without a tourniquet, what you can see here is of course capacity to bleed, contact bleeding. You cut healthy tissue, you cut, there's a lot of capillary bleeding or even arterial or venous bleeding. But if this is unhealthy tissue, you cut and then no change, no like gushing or blood or whatever, probably not a good sign. But if you're using a tourniquet, then that sign might not be reliable. In OT, also, if you have a diathermy, you can touch the surrounding muscle. If it is an excitable tissue, which is muscle lah, touch with the diathermy and it will contract. Then you know that it is a working kind of a muscle. So you can salvage, you can save that. Alright. So see, let's say you're not happy with the fracture edge kan. You remove all this hematoma. Hematoma is necessary lah for fracture healing. But this hematoma, because it occurs in open fracture, so it is presumed to be dirty. So don't keep, remove. Now sometimes, you know how the open fractures are, inside out kind of thing. It fractures through the wound and then it scrape out the soil or the anything that is outside. So all these are presumed dirty. Now sometimes you clean with a curette also, you irrigate clean, still a lot of stain, very black, very not really nice looking. So you may have to use your ronger to maybe to slightly at the edges, remove the edges slightly. You may think that this might affect your fracture healing later on, but although it's not anymore a nice interlocking kind of fragments, not like a puzzle anymore, but at least you have removed the possible nidus for infection, which is more important for wound healing. This is not just bricks or Lego, guys. We're not just assembling puzzle here. The biology is even more important. So let's say you're not happy with the wound edges or bone edges, despite the irrigation, remove, no issue. Same goes on this side. And then later on, you give it a good wash, and then after giving it a good wash, then you can close the wound. Maybe don't have to close totally. Maybe just a loose subcutaneous tag here. So in case later on there's a infection occur, it can drain, pus and all that can drain. Skin no need to close. We're not aiming for a cosmetic surgery here. If you don't close skin, probably it's safer because anything can flow out. If there is infection, then we can go in again. Alright. And then this fracture, you might ask, how to stabilize? So usually either we use a means of external fixator in a very bad open fracture, contused soft tissue. Sometimes we just put a slab only to stabilize. Maybe means of wires, can also. And sometimes open fracture, if it is not too bad, not too contaminated, maybe you can consider a primary fixation. That one is probably not your level, don't worry. I'm just telling you. So that is for awareness purpose lah. Alright, thank you for watching the demonstration.